So yeah, I'm Rena. I'm the manager for the Compassionate Distress Response Service. We have 3 services which are a part of CDRS, and they're all for 16 plus. So that's why I'll maybe give a summary of just of all 3. So the background to CDRS, it does have its foundations in key stakeholders coming together. Sorry, I'll just pass that. Sorry, I'm having. So the background to CDRS, it does have its foundations in key stakeholders coming together to explore the reduction of inappropriate referrals and waiting times to statutory services. And it was really kind of to do with not everyone needs a statutory service or intervention in the time of distress. They just need the right support at the right time, and often quite quickly. The first CDRS service was commissioned in May 2020, and the service was to deliver an immediate, compassionate, non-clinical distress response for individuals experiencing acute distress. So we do have our 3 services. The first one that's on the list there is our out-of-hours service. It's a 1-hour response time from the point of referral. It's 5 p.m. to 2 a.m. 7 days a week, Monday to Sunday, 365 days a week, and it's for 16 plus. Our GP pathway and our young people service is our daytime services, and it's a 24-hour response time from the point of referral. It's 9 to 5, Monday to Friday. So the referral pathways are out-of-hour services. It was set up originally for emergency services, first responders, but we have recently added third sector to be able to refer young people onto our out-of-hour service. And our young people pathway is for the emergency services, first responders. We've also added CAMS, secondary schools, colleges and universities onto our young people service as well. Although from schools, it's only at the moment the child protection officer that can can refer a young person onto CDRS. Although we are trying to negotiate with, that pastoral care can do that referral as well. The primary care pathway is for GPs and the multidisciplinary teams only, and that's because it's to do with reducing GP time. So that's the referral pathways coming in. To make a referral into all our services, 16 plus, the individual must be 16 plus. They must be in Glasgow in the time of distress. So they could be anywhere for our out-of-hour service. They could be anywhere in the UK, but they will be in Glasgow at the point of their distress. So that we'll pick them up, during our out-of-hour service. The young people, the young person or the individual must give consent and have capacity to engage. They can also be linked in with other services or on a waiting list at the time of their referral. And they can have existing mental health issues, addiction issues, suicide ideation, etc. as well. However, the individual cannot be in immediate risk. I mean, we would say, there's a lot, what we're seeing is a lot of young people coming into particularly our out-of-hour service and our young people service that do have suicide ideation, which is fine, suicidal kind of like thoughts, but if it is that they're at risk, then we would suggest, we would say, or we would do it for you, or we would ask you to go in emergency services. It's also not suitable for individuals who need counselling or who have asked for counselling. We're not a counselling service, and we're not a suicide prevention service either. What CDRS does do is help alleviate emotional distress through compassionate listening and providing a range of coping strategies. In the onset of the service, we really want, because it's all based in Glasgow Association for Mental Health, we wanted to make sure that we don't see all distress as being mental health issues. It's not all distress needs a statutory intervention. What we're seeing through our service, distress is related to life issues. It's life stresses. It can be things that kind of like have been overwhelming or throw us. It could be due with relationship problems, bereavement, stress of kind of like not being understood. So we see distress as kind of like in the moment, and that's kind of what we do in those situations, is provide that compassionate time and time to listen to that person. What we do is that we make sure that support is offered. Support can be offered up to 1 month, longer if needed, and we will arrange all the follow-up calls. And what we'll do is we'll arrange all those calls and arrange all those engagements to a time and place that suits the individual. We will provide that support. Support is provided either through telephone, through face-to-face, through outreach. It can be a mixture of the three. And what we're seeing for young people is that they prefer to have that face-to-face contact. One of the key features for CDRS is that it's a central location. It's a city centre for easy access. We're also beside the green, and sometimes what we're seeing is that young people, through that compassionate listening, we have a really nice kind of a comfort room at the back in our premises, but we've got the green as well. If a young person or an individual prefers to go out for a walk, we have that, those choices that we can offer. We also have a 3-way interpreting service for anybody who doesn't speak English. There's a lot of information on this slide, but I think the main thing to take from it is that our response time, in terms of what we say, is that we're going to reach an individual within 1 hour during out of hours, or within 24 hours during our daytime service. Those targets have been met. And if you see kind of from the young people CDRS part, almost young people who are referred, almost 99% are engaging with our service. So that's quite a high rate of engagement. If you think that people coming in distress or with kind of those types of presentation, they're not going to engage, we are seeing a very high rate of engagement. And what we also have at the moment is an independent evaluation, which has been carried out on behalf of Glasgow City HSEP. And that report will hopefully be out shortly, but it will kind of show some of the outcomes that we have been able to achieve in working in that kind of quick distress response with individuals. What we're seeing during our out of hours pathway is most of those referrals are coming from the mental health assessment units. The primary care pathway, again for 16+, we've got 600 GPs in Glasgow, almost, well, 83%, I think it's got a little bit higher, but from when we last looked, it's 83% of GPs in Glasgow that are referring in to CDRS. However, the young people pathway that was specifically set up for 16 to 25, we're seeing mostly internal referrals. So we're waiting, what we're seeing is that when the GP referrals for young people are coming in, or the out of hour referrals for young people are coming in, it's been signposted to our young people CDRS service. What we want to do is reduce the steps. A young person shouldn't have to go through our service or have to make an appointment or contact their GP before they're seen. The young people CDRS is our daytime service. If an individual did need support out of hours, we have that service linked in. We can discuss that with the individual, but what we're trying to do is encourage or reduce the steps for young people to go through all the different pathways that come directly to young people CDRS, because it is an immediate distress response service. We want to get to young people as quickly as possible. Yes, and just kind of on that is that we have, although we're seeing quite complex presentations from young people, we only have 1% escalation. Given that the mental health assessment unit, are seeing people who have been brought to them in a crisis, and then they're coming to us. We only have a 1% escalation back. That's very, very low. It shows or demonstrates that distress is managed effectively within CDRS. Again, there's a lot of information on the graph, but the bits that I just want to point out, the main reasons for presentations for young people is self-harm, suicide ideation, suicidal behaviour, anxiety and stress. The circular graph is showing that during the day it's more skewed towards more female to male, but during out of hours we're seeing almost 50% male and 50%, half and half presentation by male and female. Again, it shows that, you know, men are more likely to be picked up during, you know, to be in crises and then end up in a service. The bottom,
2 minutes left, Rena.
Sorry?
2 minutes left, sorry.
2 minutes left. Okay, so the bottom left-hand graph showing out of hours again, 18 to 24 is the highest age group of referrals coming into that service. To make a referral, simply phone or email our service. We also have, I'm going to miss the animation, we can maybe show that later on. We also have our young adult wellbeing service, which is a 6-month peer-based group program for 16 to 25-year-olds with mild to moderate mental health issues. It's a group program, it's up for 6 months, and it's, you know, it's really to help build young people's confidence, reduce isolation, help them be with other young people, you know, with lots of activities that we put in place. And we can also signpost young people onto our GAMH one-to-one service, which is a 6-month service as well. So yeah, I'm happy to take any questions at the end. Thank you.